The surgeon magically emerges on the day of surgery and patient goes to sleep and gets up and the surgery is done. A lot of preparation goes in before a surgery. So what the patient sees is that the surgeon magically emerges on the day of surgery and patient goes to sleep and gets up and the surgery is done. But there is a whole team and there's a whole complex science behind how every patient is planned for surgery. From my end, it is communication, a thorough consent about what are the expectations, what are the outcomes of the intended surgery, and a detailed preparation of the patient in terms of preparing for any blood products required, and a detailed anesthetic checkup, communicating with the anesthesia doctors as to any underlying condition the patients might have, getting clearances from cardiac doctors or chest physicians to prepare the patient for a surgery. Apart from that, on the day of surgery, the patient comes in the morning usually of the surgery and goes in through the pre-operative suite, and following which we take them to the OR, put them under anesthesia, get the technical team ready in terms of preparing the robot for the surgery. I create the ports for the prostate cancer surgery. After creating the ports, we dock the robot. We start the surgery. Through the surgery, the anesthesia team is taking care of the blood circulation, the lungs of the patient, and all these are optimized by the anesthesia doctors while I'm able to perform the surgery along with my assistant and my technical team. Following the surgery, we are very clear that there should be all foreign bodies which are there in the operation used during the operation removed, and we close up the incisions and I communicate with the family while the patient is being reversed from anesthesia. So following which we keep the patient in recovery for around 4 to 6 hours, following which the patient is shifted to the room. The preparation is very thorough. This is a team approach. Working in a tertiary care hospital, I have arguably the best team that I can work with. So this is all for the sake of patient care.